Ultra-processed foods are hard to avoid. They make up more than 70% of the US food supply. Think of them as foods you can't make at home. They're industrially produced and may contain things like added colors or preservatives. They're often thought of as bad for us, but scientists are just starting to answer the question of how they may be bad for us.
It's very difficult to study how foods and diets influence health in humans. We have these links that are saying that diets high in ultra-processed foods are at least associated with a variety of poor health outcomes. What we don't know is what is the mechanism underlying those links.
In this unique study at the National Institutes of Health, participants agree to spend a month living in a clinical center, where they're closely monitored and fed meticulously designed meals. 1 week could include fresh salads and another meatball subs. It's only the second clinical trial of its kind to measure what happens when people eat different types of processed foods. The first one showed that diets high in ultra-processed foods cause people to eat more calories and gain weight.
So the study that we're doing now is trying to follow up and say, well, what was it about the ultra-processed foods that led people to overconsume calories? We take complete control over people's food environments and we can measure exactly what they eat.
I've been currently living at this hospital at the NIH within the Bethesda, Maryland area. I've been here for like 21 days, even though the time goes by really fast. So everything is decided for me. The only choice I have is my water, how much I can drink. I do have 3 monitors on me that track my movement. So they know like how active I am. It doesn't really feel like it's a huge study, but I know there's a huge importance to it.
One of the things that we're interested in doing is trying to figure out, is this causal? Do these ultra-processed foods cause overeating and weight gain and obesity and then downstream consequences like type 2 diabetes and cardiovascular disease?
This is where our staff prepares all of the meals for research studies where all of the food and nutrients need to be controlled. The menus that we serve are about 6,000 calories per day. We match nutrients in terms of energy, carbohydrate, protein, and fats, as well as sodium, dietary fiber, and total sugar.
They're also controlling for 2 specific qualities that they suspect led to weight gain in the first study: energy density, or how many calories per bite something has, and hyperpalatability, when certain combinations of nutrients make you want to eat more.
We're giving them very simple instructions. Just eat as much or as little as you like. You shouldn't be trying to gain weight or lose weight.
Today, my lunch was chicken nuggets, which is kind of like a treat. But yeah, chicken nuggets, some chips, some ketchup. It was pretty fulfilling, which I kind of enjoyed.
They know that they're getting different test diets. They know that they're getting a lot of things measured on them. They're poked and prodded. They live in respiratory chambers. They're getting various different hormones measured. What they don't know is that really the main purpose of the study is to measure how these changes in their food environment are affecting how many calories they choose to eat. One study is not going to answer all the questions that we need to answer. We need a lot more research in this area to address not just the obesity question, but the variety of other conditions that diets high in ultra-processed foods are linked with. So this is just the first piece of the puzzle.